What are your thoughts on peptides?
What type of peptide?
It seems like there's so many from the Ozempic that seems like there's certainly can get you a little bit of momentum, but people stay on it forever. And then there's a lot of downsides to being on something like that forever to ones that you bring up dementia. And I'm hearing about peptides that support with dementia. I don't really know the names or the state of peptides, but it does seem like the pharmaceutical industry is really trying to shut it down.
So peptides are like a broad class of molecules that can have, in our context, we're talking about using them as supplements or medicines. And so I think you really need to view them individually. And, it's kind of batching them together is like batching, let's say, for instance, vaccines. Like people are like, I hate vaccines. And I'm like, okay, well, don't you think you should like unpack that and like maybe like look at individual vaccines? Like, same thing with pharmaceuticals. I hate pharmaceuticals. Okay, well, let's unpack that a little bit. Like this is a huge class of things. Certainly some have been removed because they're so dangerous, but you can't really batch all these things. And so peptides are very common signaling molecules used within the body. And so they are ripe for medicine targets, for creating new medications and new therapies. And the success that people have seen in certain groups of peptides for having biological effects has been pretty incredible. I mean, like the first peptide really broadly used is insulin. So like diabetics take insulin, and if you're a type 1 diabetic, like that's a life-saving medication for you. And so what I think about peptides, well, if I'm a type 1 diabetic, I love those things. Like they have allowed those people to have a normal lifespan. And they're people that otherwise would have died at a very, very early age. So I think you have to view them individually. As far as like the rise of peptides in popular gym culture, I think there's probably some good stuff there. There's probably a lot of bad stuff there.
What's an example of the gym culture peptide?
Like BPC 157. There's all these different peptides that like bodybuilders and like health people are taking and injecting. And it's kind of sketchy because a lot of them are buying them online like as research grade, like these not for human use. And then they order them and then they just inject them into themselves.
In other news, because of GMOs, monocropping, and soil depletion, Americans are not getting enough nutrients. That's why in 2018, I founded B Micro, the first freeze-dried microgreens company in the US to help Americans get more natural nutrition in their diets. Microgreens are a phase in the plant's life when they're just 14 days old and naturally the most concentrated in vitamins, minerals, and unique antioxidants. Our microgreens are all grown here in the US and certified USDA organic and regenerative organic. We grow, wash, and freeze-dry them to extend their shelf life from 1 week fresh to over 1 year, allowing us to ship anywhere in the US without the worry of spoilage. We have 2 flavors: broccoli, backed by over 2,000 studies on sulforaphane for its powerful detox benefits, and a blend of broccoli, radish, and red cabbage, our most powerful detox formula that we've tested, giving you the most bang for your buck. Easily sneak these into any meal: eggs, pizza, pasta, or even your kids' mac and cheese. We have whole leaf, powder, and capsule options, so you can choose the way that works best for you. Use code PLANT15 to save at bmicro.farm. And it's helping them build more muscle faster, like a steroid?
Depends on the peptide. So some of them are supposed to help with recovery. Some of them are supposed to help with muscle growth. Some of them help increase stimulation of testosterone or growth hormone. There's all different types of peptides that are supposed to have different benefits, and the clinical evidence is severely lacking.
Oh.
And so I'm very excited. Like, I'd love for these things to be more studied. A lot of longevity doctors are using peptides, which they think might help people age slower.
That's what I was seeing in my research, but just very surface level. Is there maybe a top 3 peptides that seem promising to you, and then like a top 3 peptides where you're like, these are not it?
I mean, the most interesting, most promising peptides are the ones you have heard about. These are the GLP-1 agonists. So tirzepatide, which is Mounjaro, semaglutide, which is Ozempic. I mean, these things have like profound biological effects. Essentially, they force people into a medical fast, which I'm a big faster. Like I do intermittent fasting, I do prolonged fasting, and a lot of these people just need to stop eating. And like these peptides help them do that. And so they're improving people's metabolism. And because we have like this issue in society where like 90% of people have at least one sign of being metabolically unhealthy, you give these things, and since unhealthy metabolism increases your risk tremendously for things like of course, diabetes type 2, but also things like heart attacks, strokes, a lot of different types of cancers, and organ dysfunctions like liver and kidney dysfunction. We're seeing these metabolically unwell people take this peptide, and a lot of these other organ issues get better and better. Now, long term, we don't have a lot of great long-term studies. Could there be a price to pay for this? Absolutely. But yeah, from a longevity, from a medical standpoint, that's the most interesting one because we basically have an epidemic of metabolic disease, and that's the one that targets that directly. As far as the like popular, more fitnessy type peptides, I have looked into these pretty in depth, but it's not top of mind for me to kind of spit off a lot of information about them. What I can say is that a lot of people are really excited about them, a lot of smart people, but they just don't have hardly any clinical evidence. I mean, most of them have zero clinical evidence, and a few of the more popular ones might have like a case series on like, 5 to 10 different patients, say, improving their recovery with 6 months of use. So like very small targeted studies. So we just don't know. One of my concerns with peptides is that a lot of them are intended to increase the secretion of growth hormone, which I think maybe from a short-term gain standpoint, increasing growth hormone may be helpful, like if you're trying to like put on muscle as like a bodybuilder. But long-term, I have some concerns about that from a longevity standpoint. It may be getting more gains now, but trading time in the future. Mm-hmm. And so I have some concerns about that, and I really think these things need to be studied robustly before they're recommended broadly. And for that reason, I am, those are not on my recommended list for longevity. Like I'm really focused on lifestyle, environment, disease prevention, and disease management if you do have an existing health issue.